Hello everyone, Dr. Callanan here. In this video, I wanted to walk you through a patient case and talk about why I'm not a huge fan of food sensitivity testing. Now, before we get into it and share some alternative testing that I feel is more beneficial and impactful for individuals, if you've had food sensitivity testing, I'm talking about the IgG food sensitivity testing, and you've seen great results with it, I'm not trying to discount those results that you've had. I don't see it as completely invaluable. But this is a common scenario that I see for individuals that come to my practice who have done food sensitivity testing. So this patient was a female in her 20s. She was experiencing significant amount of stress during 2020, and she started to notice some looser stools and heartburn. Now, she had never had food sensitivities before, but what she was finding as things progressed, that her ability to tolerate certain foods was becoming more and more problematic. And the looser stools was impacting her ability to eat healthy. It was impacting her ability to exercise. And she was also developing anxiety. So what we decided to do, because she had done the food sensitivity testing, she had removed those foods. And unfortunately, her diet has become very restrictive and it's creating a lot of stress for her and she's still not feeling better. So let's go through what we initially ran. So I am a big fan of functional testing in terms of a DNA-based PCR test called the GI map. We did run that test, but we also started with some traditional blood work testing to screen for things like celiac disease, as well as we did blood work assessment for H. pylori. Now, H. pylori is a bacteria that can reside in the stomach that can contribute to stomach ulcers. In some cases, with certain variant strains, we can see increased risk of certain types of cancer, stomach cancer, duodenal cancers, and ulcers. And I really wanted to screen her for that. Now, the blood test is better for acute cases, so early onset cases, whereas she has been experiencing these symptoms since 2024. That's why we also wanted to do the stool test to see if we can pick up a chronic case of H. pylori. We tested her vitamin D. This was healthy and normal. We did a tissue transglutaminase and an IgA to screen her for celiac. This was normal as well, whereas the GI map stool test will have a look for gluten sensitivity. This was for celiac. That came back negative, which was great. And our H. pylori testing here came back negative. Now, this does not necessarily rule out a chronic case of H. pylori. Then what we did is we had a look at her GI map test. It was not pictured here. I must have missed the first slide, but we also did a conventional ONP, so an OBEM parasite testing through our conventional means. And one of the parasites that is considered non-pathogenic, meaning that it usually doesn't cause symptoms in the vast majority of individuals. Blastocystis hominis actually came up for her on traditional testing, and we also saw that on the GI map. So when we see a non-pathogenic parasite, meaning, usually it doesn't cause any symptoms, and usually it resolves on its own. If we have a patient that's symptomatic, we may want to have a look at treating that for her. And I'm going to walk you through the GI map results and then what we did for treatment. It is my opinion that new onset food sensitivities are usually related to something else, whether it's changes to the gut microbiome, whether it's elevations in zonulin suggestive of leaky gut or intestinal hyperpermeability. Usually, in my opinion, new onset multiple food sensitivities are due to something else, not necessarily the foods itself. You can do the food sensitivity testing, you can remove those foods, but it's not really getting to the root cause. Plus, it creates a very restrictive nutrition plan. And I have individuals who come to me on low FODMAP diets, and they've been doing a low FODMAP diet for months and months and months. And that nutrition strategy is really only designed for short-term use and not a long-term strategy. So what came up on the GI map? The first page, these are all the major pathogens. Everybody agrees these create significant signs and symptoms for individuals. These are things like your C. difficile, your Salmonella, your Giardia. These all came up less than detectable limits or less than DL. When I'm going through a GI map report, I quick look at the first page, and this is essentially what I'm doing on a patient consult. I'm explaining the test to individuals so they understand why they're feeling the way that they're feeling, and then they can understand their treatment plan. The next thing that we did is I actually scroll down to the very last page. And the reason I do this is to look at the health of the intestinal cells overall, right? So we'll start here and then we'll work our way back up. Steatocrit, the first marker, this tells us about the amount of fats that are present in the stool. When you consume healthy fats, avocado, nuts and seeds, extra virgin olive oil, these should all be digested and absorbed. We should not be seeing high amounts of fats present in the stool. We're not seeing this here. It's less than detectable limits. In terms of the elastase, this is a marker of pancreatic exocrine function, which means pancreatic enzymes. These are responsible for breaking down proteins, carbs, and fats. This is actually looking pretty good. I like to see it greater than 500. She's pretty much there. This means that this individual is probably not going to see significant benefits in taking a digestive enzyme. Now, if she has a lactose intolerance and she takes lactase to help with that, or if she has a really high protein meal, she may benefit at that point in time, but it's not the core focus of our treatment plan right now. GI markers, beta-glucuronidase, and fecal occult blood, so blood in the stool. These are markers that are associated with colon cancer risk. These ones were healthy and normal, which is great. Here's where we start to see some concerns. Secretory IgA, this is your immune response. And I like to explain this as lining your entire GI tract, you've got an army of troops. This is like the secretory IgA. And they're responsible for keeping things out of the bloodstream, right? So if your GI tract is a tube, behind that tube is the bloodstream, and you need a strong immune system to say, no, you need to stay in here. Okay, you can come in, stay out there. This is your line of defense against bacterial infections, parasitic infections, etc. Now, the secretory IgA is on the lower end, which we can see in patients with chronic stress, nutrient deficiencies, so things like vitamin A and zinc, as well as individuals who are over-exercising. So she wasn't over-exercising because unfortunately her GI concerns were impacting her ability to exercise. But, of course, with 2020 and then developing these new onset symptoms, it was particularly concerning. So stress is a factor that we need to have a look at. First thing, what I do when I see a low secretory IgA, I consider making sure that the diet is rich in vitamin A. So vitamin A are orange foods, egg yolks, sweet potatoes, carrots, melons, cantaloupe, mangoes, peppers, anything that's orange usually is higher in vitamin A. In some patients, we might consider supplementing with vitamin A, especially if they're exhibiting other symptoms of a vitamin A deficiency. So things like keratosis pilaris or bumps on the arm, heavy menstrual cycles, acne, those could all be other symptoms, skin concerns of vitamin A deficiency. I showed this patient the list of vitamin A foods. I'm like, hey, can you start to incorporate more of these in your diet? If not, we're going to supplement. She's like, yeah, I'm going to do vitamin A foods every day to make sure I'm nutritionally getting enough. Okay, great. Anticollidin IgA was on the lower end. Eosinophil activation protein can be associated with more food sensitivities, allergies, histamine-related concerns. This was fine. Calprotectin is a marker of inflammation. This is usually diagnostic, or it is diagnostic for Crohn's and colitis, and it might warrant, if it's high, further investigation with a colonoscopy, but this looked really healthy and normal. And zonulin, a marker of leaky gut, was low, which is great. So we don't necessarily, I'm not thinking that these multiple food sensitivities are coming from leaky gut. So the very first thing, stress management, vitamin A rich foods, we need to support the immune system. This is really important as the first step, because if you don't have a strong immune function and we start to go in and eliminate bacterial infections, or we start to eliminate parasites, or we start to eliminate H. pylori, if you don't have that strong core immune system, you could be getting the symptoms back, or it's harder to treat, or you're going to be coming back to my practice in 3 months' time saying, I was feeling good initially, and now the symptoms are back. So that's the first phase. Now, remember, on our traditional stool test, we had Blastocyst hominis come up, a non-pathogenic parasite. Saccharomyces boulardii, this is a form of beneficial yeast. It's similar to a probiotic, but it's not really a probiotic. That one can support the immune system. And there's also some comparative studies comparing metronidazole to Saccharomyces, which may help with the Blastocyst hominis. There was similar eradication rates. So we started her on the Blastocyst. We started her on the Saccharomyces boulardii. We started her on vitamin A rich foods in her diet and stress management. Now, after that phase, what we do is we scroll up on the GI map test. Worms were not detected. We had one of the protozoa, the Blastocyst hominis, come up high, and it was decently high there. A lot of her symptoms match Blastocyst hominis. And this particular parasite as well, what it can do is destabilize mast cells, and we start to see higher histamine levels. And with higher histamine levels, we can start to see those food sensitivities and sometimes rashes for individuals. So we're already treating this with the Saccharomyces boulardii. Could you use metronidazole? Of course, but we're going to see, do things clear on its own with the Saccharomyces. Viruses, less than detectable limits. Candida, less than detectable limits. And then here's where we start to get into some of the opportunistic bacteria. So these are bacteria that are fine in low amounts, but given the right opportunity, they can overgrow. So we are seeing slightly higher levels of the Pseudomonas, slightly higher levels of the Staph and the Strep. But if we really look at the reference range, I know when something's flagged red and there's an arrow and it says high, it draws our attention and we think it's significant. But we really have to interpret this with caution. If we look at the Pseudomonas, each of the 2 means that you need to move the decimal place over 2 points, right? So we have 702, the reference range is 500. In the grand scheme of things, of all of the bacteria in the gut, this is really not significantly high. Same with the Staph and same with the Strep. Some practitioners may go in here with antimicrobials, Candibactin AR, Candibactin BR, GI Microbex, oil of oregano to treat this bacterial overgrowth. But I want to start by supporting the immune system, getting rid of the Blastocystis hominis, and starting with the H. pylori, which actually came up positive as well first, to really see maybe once we get the H. pylori gone, the Blastocystis hominis gone, if her symptoms all completely resolve, she's no longer having looser stool, she's no longer having bloating, she can add those foods back into her diet that were previously bothering her, we may not need to address this at all. And this is where it's really important to pair the patient's symptoms with their blood work. Okay. H. pylori, this is a bacteria again, lives in the stomach. It can change the acidity of the stomach. It's very common to see acid reflux, indigestion, changes to appetite. You can also see bleeding gums, and H. pylori has been associated with increased prevalence of mental health concerns. Remember, she was experiencing a lot of stress, more anxiety, and there are some interesting studies with H. pylori causing symptoms seemingly unrelated to the gut. So mental health concerns, chronic unexplained hives or chronic idiopathic urticaria, we call it. H. pylori can be a factor there too. H. pylori can be a triggering factor to some autoimmune conditions. We can see bruising with H. pylori. So this is a very interesting one. Now, what we do know is 50% of the population can be carriers of H. pylori. So the goal may not be complete eradication. And as long as you don't have any of the virulence factors, and as long as your levels are not above the range, it may not be necessary to treat. Because she is symptomatic, this is one that we're going to address. And the other thing is the treatment protocol that I utilize for H. pylori when we're looking at natural health products, one of the products is oil of oregano. And oil of oregano also has efficacy or effects against the Staph and Strep, which came up below. So I think this is going to be a great plan for her. In terms of the treatment, for H. pylori, the conventional therapy is triple therapy that involves the use of a proton pump inhibitor, so an acid-reducing medication, as well as antibiotics. Could she use it? Perhaps. But I think, if we look at the studies on mastigum, oil of oregano, bismuth salicylate, probiotics, and fiber, it's about 78% effective. And the treatment that I follow is based off of that study. So there was a study, it's called Successful Eradication of H. pylori with Over-the-Counter Products. I've done another video specifically on that. I follow that treatment plan if a patient is interested in doing the natural health products, and I actually see really good success with it. So the other thing with H. pylori is you can have different virulence factors. And what this means is how likely is the bacterial strain that you specifically have to create a concern. So the strain specifically that this individual doesn't have any of the virulence factors. So it's unlikely to be very difficult to treat. We're not seeing increased risk of the cancers associated with H. pylori for this strain in particular. And we're also not seeing associations with the strains of H. pylori that can cause ulcers. So I think this is going to be a really quick 20-day treatment plan for the H. pylori. So we do the 20 days of the mastigum, oil of oregano, bismuth salicylate with the Saccharomyces boulardii to treat the Blastocystis hominis. Before we reviewed the GI map, she's already been on a treatment for Blastocystis hominis with the Saccharomyces boulardii for about a week, and she's already feeling better. In terms of the normal gut bacteria, overall, I think this looks really good. So we're seeing appropriate levels of Akkermansia, which is key for metabolic health and weight management. Fecal Calibacterium prausnitzkii is a really important bacteria because it produces butyrate, and butyrate is like a food source for the intestinal cells to keep them happy. The lower levels of beneficial E. coli, it's very minorly low. I'm not concerned with that. And, overall, she has an abundance of healthy gut bacteria. So I actually don't think probiotics here are going to be very beneficial for her. I don't think she needs a probiotic long term, as long as she has fermented foods in her diet, lots of prebiotics, so the fibers from the food she's eating. She's getting outside and she's not taking medications unnecessarily that might negatively impact the health of the gut microbiome. So again, quick recap. Patient comes in, she's had about 3-4 years, bloating, heartburn, looser stools, multiple food sensitivities. She tried the food sensitivity testing, invested in that, removed all the foods. She did not get better. And really, she did not get better because the foods are not the problem, right? So we're treating Blastocystis hominis, H. pylori, and then we're going to see. We're also treating the lower immune function. And we're going to see, how does she do in the next 20 days? 20 days, right? And she's already feeling better in 1 week. So if all of her symptoms go away, she can reintroduce the food, see how it goes. Maybe a digestive enzyme in the future if she has a really high protein meal. But what I really value in this testing is it gives us a really clear path, and it gives us a really clear understanding of step 1, step 2, step 3. And I think if done in a very simple, straightforward way, so the individual can understand what the results mean. When I go through this with a patient, it is a little bit slower, clarifying questions, and then I'll type up a report for the individual so they understand why we're doing each thing and what each marker means. So I hope that was helpful for you. The GI map test is available to order if you're in the US directly through Rupa. If you're in Canada, you can reach out to my office and we can see if we can support you through this testing. And I think it's a wonderful test, and I've seen really great results with it when we follow a stepwise approach. So if you have done food sensitivity testing and you've eliminated those foods and you're feeling like your nutrition is becoming restrictive and you're not seeing the results that you want in terms of your symptoms, consider this. And I am accepting new individuals to work with as well. So if you want to see if we have available appointments, just reach out to my patient care coordinator, Allison, and we're happy to take an assessment. I hope this was helpful. See you in the next video.